You're listening to the Endocast, a podcast about all things endometriosis, with your hosts, Britt Thelman-Pangrel and Dr. Eric Heegard. Hey guys, it's Britt, and I'm back here with my friend, Dr. Eric Heegard.
Hello, good day.
Good day.
Good day to you all.
I love it. So, Dr. Heegard, today we are going to talk about making babies. We're going to talk about
babies.
Infertility and endometriosis, obviously. Mm-hmm. And how often would you say, I mean, just to ballpark it for us, I know I didn't ask you this in advance, so you're on the spot.
Okay.
How often do you see patients come in strictly for pelvic pain versus because they're trying to have a baby and they can't get pregnant?
Well, a fair amount, actually, because I've always done a fair amount of infertility work. And so in going through the evaluation, again, if it's easy, people have done it already. You know, again,
Sure.
if, you know, there are a lot of things that can kind of impact a couple's fertility that may just cause them to get pregnant, take longer to get pregnant. And so, but people have kind of gotten past that phase by the time I see them or somebody else who does fertility stuff. And so it's pretty common just in going through the process of evaluating them. That again, I know we touched on this a little bit in another podcast, but you're trying to figure out what could be the underlying issue that's changing their odds, because it's all odds.
But give me a percentage here. I'm putting you on the spot. You got to commit to a number.
How many? What percentage of my
10 people
patient?
walk in. 10 patients walk in. How many are for pain and how many are for infertility?
For me, probably 2 are for fertility.
Oh, really?
Yeah, it's virtually all pain.
Okay, interesting.
Yeah.
Interesting. So,
was that specific enough for you?
yeah, no, it was. I wanted you to get to the meat.
Okay.
For me.
All right.
So 20% in your case, but I think that part of that has to do with your practice now.
Right.
And I think, you know, maybe if you're not experiencing pain or really heavy periods or some of those very common other endometriosis symptoms, you know, maybe you're past that point. There are different stages of endometriosis, right? Mm-hmm. And I know in my case, you know, with my infertility journey, I had a lot of those pain and those early symptoms that a lot of people relate to more stage 1,
right, minimal,
mild disease back when I was in high school and college. And then by the time, you know, I met my husband and we were married and ready to do the thing, I was having new symptoms. So it wasn't necessarily pain at first that pointed me in that direction. So no, I was seeing a different, just to like dive into my own infertility story here a little bit, I was seeing a different practice. Mm-hmm. And I went in, they often want you to do a sort of like a wellness check, kind of before you want to start, get a baseline, see how everything's going. They do a lot of thyroid tests. What's the point of that? Like blood tests?
Well, if you're trying to get pregnant, sometimes you can have subtle thyroid or some issues, or even not subtle thyroid issues that can really affect your ability to get pregnant as well as ovulation.
Okay.
You know, thyroid disorders are big, can wreak havoc on your ability to release an egg at the right time.
Okay, because the thyroid is in charge of hormones, right? And telling what hormones when to go and fire and...
Well, the thyroid is in charge of itself for the most part, which is it produces thyroid hormone.
Okay.
But thyroid hormone affects virtually every aspect of your body. And why it causes people, if it's for some people and if it's bad enough for to have trouble ovulating, I can't explain right now because I would need to research it.
No. I respect that.
The fact is that it does.
And we've talked about endometriosis being kind of a basket of diseases you could have.
Right.
And thyroid conditions go hand in hand for a lot of people with endo.
Right. And also just that it's one of the obvious, or some, like I said, sometimes not obvious things that can impact fertility, and it's an easy test. You don't have to stick a needle in somebody's brain, or not that we ever do that.
Yeah,
it just came out of my head. But it's just a blood test, and it's not terribly expensive, and it's it's common enough that it's a pretty standard thing to check.
Okay, so we did all the baseline stuff, right? And I had a physical, and everything was fine, and I had been off of hormonal birth control that I had been on since college, to help control, pain and everything. And then it just started to get worse. So we were maybe 5 months in, and then the pain started getting bad for me. And that's when my fertility journey that first year shifted from really being about trying to get pregnant and then more so trying to figure out what the hell was going on in my body.
Right. So you were dealing with trying to get pregnant and having pain.
Right. And nothing says sexy baby making time like being in pain all the time.
Right. Exactly.
I don't mean to laugh. It's my own, it's a coping mechanism at this point. So, we were going down this route and then we're coming up and there's only a few months left in the year and I'm not able to work, or I'm going into work and then I'm leaving crying. And my husband's asking if he wants me to pick him, if he wants me to drive him, or he wants to drive me home because I can't drive because I'm in so much pain.
What a sweet man. Can I just tell you, when you talk about him, I think I've met him briefly one time. He sounds like a keeper.
He is.
I would keep him if I were you.
And
not that I have.
But that's hard on your partners.
Yes.
And when you care about somebody, you want to fix things for them.
Right.
And actually, he was the person. So at this time, I was researching and realizing that, okay, so beyond not being able to get pregnant, now I'm in all this pain.
Yeah.
And it wasn't just pain around my period at this time. It was since I'm tracking everything. So if you're on this infertility journey, you might be using several tools.
Yeah.
So I was using an Ava bracelet at the time, which is kind of the new version of taking your temperature.
Mm-hmm.
So they have these, now I'm going to forget what these thermometers are called, but they have these thermometers.
Digital thermometers that are really precise.
Yeah, and so you're supposed to take your temperature every morning, and when you enter certain phases of your cycle, your temperature will spike.
Yeah.
Is that your luteal phase?
It's your temperature will spike after you ovulate.
Okay.
And because of the progesterone.
Right. Okay.
But so yes, it is in the luteal phase, but the luteal, I don't mean to be splitting hairs here, but the luteal phase is, 14 days. Really.
Yeah, exactly.
So the temperature goes up after you ovulate.
Right. So the goal is to track all of that, and you kind of map out your cycle. So I was doing all those things, and I was using the bracelet instead because it was a more passive way to do it. It would take your temperature like while you slept, and then you didn't have to wake up at the same time and not move. Like
it's crazy, and that but the taking your temperature, what we call basal body temperature, you almost
Thank you. That's what I couldn't think of.
So you have to. So you're supposed to wake up and not do anything else, and then just reach over to your digital thermometer and take a temperature. And most of us could not remember to do that, and it's.
At the same time, every day, including the weekends, like.
Right. And it really, I think it has kind of limited. It doesn't really, because by the time the temperature goes up, you've already ovulated, so you've missed your window. So it really is. You have to look historically and say, okay, if you're one of these rare people who actually ovulates on day 14 or day 16 or whatever every month, you can then say, okay, we got to confine intercourse or intimacy to the time before you ovulate. You want to have sex. The sperm needs to be on its way.
You're skipping ahead.
All right.
You're skipping ahead.
But the thing is that.
I agree with
so
you.
what's the point of knowing that you've already ovulated?
Because it's about charting.
It just makes you feel good. It's just, for some people, it's so hard to do it, and you can just talk to somebody and probably get an idea of when they're ovulating and time based on that. How do you like that?
Okay, I disagree with you because charting was really helpful for me. And the reason why is it pointed out where irregularities were in my cycle. So when I was further down the infertility track, all my past charts really helped.
So to see if you had a luteal phase defect?
Yeah, exactly.
Ooh, how do you like that, Britt?
Yeah,
just threw that out there. Luteal phase defect. Just to make it sound like we're...
So either way, I don't want to get into all the specifics on charting, but I was doing all of that. And if you're interested in learning more about charting and fertility, and you're kind of at the beginning of your journey, or maybe you've been trying for a long time, it's not working, my favorite book to recommend is called Taking Charge of Your Fertility. It's pretty thick. It's big. I bought mine on Amazon, and it's a beautiful book that first of all, it has a great definition of endometriosis, and I don't find that in a lot of generic books out there. But this one walks you through different ways to chart and different techniques. So we talked about basal body temperature. I was also using my cervical mucus, which so fun to talk about mucus.
Yeah. Have you ever heard the word, I don't know if anyone, spinbarque?
No. You always say random things I've never heard of.
I love that. Spinbarque.
Okay,
It's
tell us
like,
what it means.
it's the German word for how stretchy your mucus is.
Oh, yeah. Okay, so when you're talking about cervical mucus, there are different phases, and it tells you like what your mucus looks like, whether it's slippery and watery or if it's, they say egg white like. And I want to know who's playing with egg whites that knows.
You want to hear something? This is something I think is so fascinating, Britt. And you probably know this, but for most of a woman's cycle, if you happen to, or a person who with periods,
correct,
cycle, the cervical mucus is like a barrier. It's like a brick.
Yeah.
And for good reason. It protects the inside of the uterus and the fallopian tubes from infection and that sort of thing. And so those, when you have, if there is sperm present at this time when it's not slippery and watery, sperm are just like pounding on the door. Bang, bang, bang. Let me in. Let me in. No, can't get in.
It's a natural barrier.
Go back, turn around. And so, but just around when the estrogen levels start to just go screamingly high right before you ovulate, it changes the matrix of the mucus to being like, I'm not sure this is correct, but I think it is, and I think it's a good descriptor. It from this like crisscrossed sort of web,
okay,
right? So all of a sudden they align. So they're all facing the same direction. So it's like channels that open. So the sperm can. I'm swimming. If you could see me, yeah, and it turns into this thing where the sperm can get. And but that only happens for a limited amount of time.
Right.
Okay.
Okay. So there are lots of ways to track, but that book covered basal body temperature for me, cervical mucus, also those LHP strips.
Mm-hmm.
So there are these little tests. It's not a pregnancy test, but you use it in a similar way.
Ovulation predictor kit.
Yeah, ovulation predictor kit. And you can buy them really cheap on Amazon in like bulk.
Yeah.
So if you don't want to keep spending $20 at the drugstore, look online. But you pee on them every day, and you take a picture, and then you watch and see how strong the line in is, and that's how close you are getting to ovulation. So then you know like when you've peaked, and you want to make sure that you're having lots of intercourse before that time, because lots of sex after that doesn't matter.
Well, that's the thing that's so great about these ovulation predictor kits or LH surge kits is that they're helpful because they show positive before you ovulate.
Exactly.
Whereas basal body temperature charting, the temperature goes up after.
But together, these tools together can really help you kind of map out your cycle. And it's important, from my perspective, if I could have done anything over, it would have been to start sooner on this. But, I was starting this and I was going through all this pain, and things I was noticing because of these tests were I wasn't getting the egg white stretchy cervical mucus.
Oh.
And I was not always getting an LH surge, but I was always getting my period. So it's interesting because I was bleeding between 28 and 32 days every month, which is fairly normal. Yeah. But my tests were showing that I wasn't necessarily ovulating all the time.
Okay.
And you can't get pregnant if you don't ovulate. I don't know if you know
Correct. that. I remember that course somewhere back there. Yeah, well, that's what I'm just curious to know what I would say in response to that pattern, but I'd be curious to know what you saw a fertility specialist, subspecialist. What did they?
Not yet.
Oh.
So this is when I was still at that other practice.
Okay.
And then the pain took over, and it was like less about trying to get pregnant and more about trying to figure out why my body was trying to kill me every month. Yeah. And I have that, like, I had this weird, I call it a fish hook pain, where it was like,
I remember you describing that. Sounds dreadful.
Through my belly button, and like someone with a fish hook. Have you seen I Know What You Did Last Summer? Okay, it's a really bad like old horror flick. And the guy has a fish hook, and for some reason, like, he guts people that way. It felt like I was being gutted by a fish hook between my period and 2 weeks after. So that phase when I should have been ovulating, and it was so
I can only imagine. Just from hearing people describe, but that's just sounds
But if you
horrible.
Google belly button pain, endometriosis comes up like instantly almost. Just interesting.
Yeah, I wonder what the mechanism of that is. Although, can I ask you a question? Did they find any endometriosis up there?
No, not necessarily. I think I have a small umbilical hernia, but we're not really sure necessarily what that related to.
I have an idea.
Physiologically.
Can I just throw forth my little theory?
Do it.
Which is that there are these ligaments that go from the low pelvis, called the obliterated umbilical ligaments, that go right from the low pelvis into the belly button.
Okay.
And those are left over from when you were a fetus, when we all have this when we were fetuses?
Feti?
I
don't know.
We'll call them feti today. Fetus. I think it's fetuses. And those are what were the umbilical arteries. When you were a little fetus floating around, right? You blood flowed through there, and then after you're born and the ovarian the little window in your heart slams shut, the circulation spins around and goes the other direction. It's incredible, Britt. You don't think about it, but right after you deliver and the baby takes this breath, the foramen ovale just shuts like a trapdoor, and all of a sudden everything just spins around backwards, and those umbilical arteries aren't needed anymore. And so they scar down and they become this ligament, but it goes right in through the pelvis. So there's undoubtedly some nerves traveling in there. I think that irritation in the pelvis could irritate the nerves that go along that to the umbilicus, the belly button. And
you're such a dork.
I am just.
But
I
you're
think
so
that's
excited.
I think that's it, and at least it makes some sense when you're trying to.
No, okay,
exercise.
that's cool. That's interesting.
Thank you for at least pretending to be.
No, I mean now I'm curious. I want to go like Google all of this and look at pictures of, the umbilical.
No, I can't
arteries. The arteries.
I can't. Yeah, the umbilical arteries, but it's the obliterated umbilical. I am not.
Right.
I knew what I was. I said it. About
I just need to see a
2
picture.
minutes.
That's cool.
It's cool. Yeah, you can see this fold that is in the anterior abdominal wall that goes right from the
anterior, like the front.
The front side. Yeah,
okay.
Excuse me, towards the belly button.
Okay.
And goes up and crosses and comes right to the belly button.
Interesting.
Oh, God, it's great. It's
okay, so maybe that was what caused my fishhook pain.
Yeah.
But
No.
I don't know.
Yeah.
So either way, that's when I was reaching out to a friend and I was telling her about my symptoms, and she happens to be a patient of yours. We've talked about this. And she's so wonderful, Jordan Turgeon. I can say her name, she said.
She wouldn't mind?
No, she's all about this stuff. And she said to me, don't just do surgery with your surgeon, with your gynecologist. I didn't really like them at this point anyway, so I was totally okay with that. I mean, the nurse had said to me, what do you want me to just have them cut you open? That's not a very nice thing to say to someone who's like in pain and can't get pregnant. Like, that's rude. And she was like, I think you're just frustrated about not getting pregnant. And I'm like, well, at this point, I'm in too much pain to have sex. So I'm pretty sure that's not my only frustration. But Jordan recommended I see someone like you. She pointed me to Nancy's Nook. And that's when I really took my health into my own hands. And back to how great my husband is, he said to me, he's like, I love you, but I'm really sick of you complaining about this. You need to just do something. What are you going to do?
Yeah.
And that's when I went down the path of trying to find someone. And I couldn't get in with you because you were having your own procedure done.
That's right.
And so I got in with Dr. Palmer, who's a friend of yours.
The esteemed Dr. Palmer, who's a superb human being,
Yep.
a kind soul, and just a rock star surgeon.
Yeah, at Oakdale OBGYN. And he sat down with John and I and went through my 9 pages of personal notes and my medical history. Never did a vaginal exam on me. But he said based on my symptoms, and, we're talking about a history of painful periods, ovarian cysts, pain with sex, and bowel, and like constipation and painful bowel movements and painful urination. All of that stuff he felt was enough to proceed with surgery. So I was excited because I think a lot of endo patients can relate to this. When you get to a point where you're ready for surgery, you've already kind of diagnosed yourself.
Right.
And you go through this mourning process of, okay, not only is something wrong, like it's very self-actualizing. Not only is something wrong, but here's what I think I need to do about it. And now I need to find someone who agrees with me
Right.
a little bit. And not everyone in the medical community will do that with you. I know I had people in my life telling me, not my immediate family, thank God, but others telling me, well, stop Googling things. You need to listen to your doctor. And I respect that, but my doctor didn't have, they had all the tools available to them, but they weren't using them to help me on my journey.
Right. And people need to, I know we've talked about this before. You need to advocate for yourself.
Yeah.
Because, nobody knows
no
their
one
body.
knows what your normal is.
Exactly.
More than you do.
Right.
So we got surgery scheduled. I had surgery in January of 2018. And, the best and the worst thing ever, I remember waking up and just wanting to know, do I have it? Right. And I cried beforehand saying, like, what if you don't find anything?
That's very common. Yeah. People are terrified that you're going to go in there and not find something to explain it.
Right. Because at that point, you're just desperate to know.
Yeah.
So when I woke up and he told me I had endo, I was stage 3, he found it on my left ovary. My left ovary was pinned behind my uterus. All of that was pinned to my colon. And they took out my appendix and biopsied it, but they did not find endo in there. But just that there was a lot kind of all over.
Yep.
It was like the best and the worst news.
Right.
All at the same time.
Right.
So I would say, obviously talk to your doctor if you're having surgery and you're also trying to get pregnant. Talk to your doctor. I think he said we had to wait just a few months before trying again. So I would say we waited a couple months and then we really were trying again 4 months later. And at this point now we're like a year and a half into our journey.
Yeah.
And now I'm frustrated because I'm like, I did the surgery. I'm feeling better. I did pelvic floor physical therapy. Thank you. And I changed my diet to get rid of a lot of inflammatory things like gluten and a lot of caffeine, and tried to do a lot of alcohol reduction, which is hard when you're doing infertility and you're frustrated and sometimes you just really want a glass of wine. I'm just saying.
This is I'm just alcohol reduction. It's just I don't know if I've ever heard it phrased that way.
Well,
I've heard of people cutting down on gluten and dairy, like dairy reduction. I don't know if I've heard anybody say
but
alcohol
choosing
reduction.
between wine and cheese, man, that's really a hard spot for me.
Do you have to choose?
No, I kept both of them.
Okay, right.
That's why I was like, let's cut the gluten. So, I'm a year and a half into my journey at this point, and I said to Dr. Palmer, I'm like, okay, well, my ovaries have kind of looked PCOS-y.
Mm-hmm. PCOS.
Polycystic ovarian syndrome. And that's where your ovaries, describe this for me in a more medical way.
Well, polycystic ovarian syndrome is also very common. I think it's at least 10% of the population. I'm just throwing that out, but I think it's pretty well. And it's a condition where you see a few things. One is that oftentimes the woman doesn't ovulate or release an egg on a regular basis, so they have irregular periods. Number 2, they can have cysts on their ovaries. And number 3, they can have elevated levels of testosterone, or what we call androgens. And that can cause, for some people, coarse facial hair on their stomach or abdomen, acne, and that sort of thing. So it's a kind of a constellation of symptoms. And it can be very hard for some of these people to get pregnant.
So I didn't have a lot of the outward symptoms, and my testosterone levels weren't elevated, but I did have the appearance. And once you're on this infertility journey, I just got to say, I'm pretty good at ultrasounds myself these days. I can kind of point things out with no medical degree or training.
That's true. I'll just tell you that, like in a lot of things, people who are experiencing it end up being as much of experts sometimes.
So don't discount it if you're having a weird feeling or you see something
Listen
off.
to yourself. Exactly.
See something, say something.
Yeah.
Yeah. So we were looking at my ovaries and we would see this, like, they say it's like a pearl look to them.
A ring of pearls around the edge of it.
Right, because you have all these follicles develop, and then one follicle is supposed to be like, dun-dun-dun, the major one, and that's the one that produces the egg and releases. Well, in polycystic ovarian syndrome, you have all of these little follicles developing, but no one takes over, right? Because your hormones just aren't as balanced. And so we were seeing that a little bit which could have contributed to my
Luteal phase.
anovulation and my luteal phase issues, we were talking about before. So then I was like, okay, well, do we want to try going on metformin, which can help, which is more so for an insulin resistance? When do you prescribe that?
Well, you can, I prescribe it a fair amount because it's safe.
Yep.
It's usually pretty well tolerated, at least at low doses. And people with polycystic ovarian syndrome probably have, even if they don't, even if their insulin levels are not elevated beyond lab results, it's probably elevated for them.
Right.
And so there's a component of insulin, what we call insulin resistance, meaning your body has to produce more insulin to control your blood sugars than somebody who doesn't have it, or even if you didn't have it.
Sure.
And so that's why. And so if you can drop the insulin levels and resist insulin resistance, for some people with polycystic ovarian syndrome, they can start to ovulate on their own.
Yeah. So he started me on that, and he said, one thing you want to be careful about here is that it can cause digestive and stomach issues.
Correct.
But in my case, it was excellent.
Oh, really?
Because I was having constipation issues.
So it just kind of...
So it was like a jump start for my body. So I really enjoyed being on metformin. And they're not paying for this podcast, but that's just my personal opinion. So we started that route, and then, a few months later, still not pregnant, still doing all my things, a lot of timed intercourse, not missing my window. I was using like 6 different ways to determine my window. And there's plenty of apps out there. I wouldn't say any of them are better than others. I was using 2 different ones, but Fertility Friend was maybe my favorite, and I paid for the little extra where they help you analyze your cycle. So if you're looking for a specific app, I like that one the best, along with that book that I recommended. But that's when I started going back to Dr. Palmer and saying, okay, I think I want to move on to the next step.
The brilliant Dr. Palmer?
Yeah, the brilliant. We were
I think he is.
More than a year and a half in to our journey now. And obviously, Google and I were pretty good friends at this point.
Mm-hmm.
And I'm thinking, okay, so what's Clomid? What's Letrozole? Where do we want to go? And he referred me. This is also what I like about great doctors know what their expertise is. And Dr. Palmer knows that his expertise is in endometriosis and in excision surgery. And he knows that while he's had education and training in fertility and infertility, that necessarily isn't his specialty. So I saw a different doctor at their clinic, Dr. McAvoy. Mm-hmm. And what I liked about her is she had been through it herself.
Right. So
she knew. She'd done IVF, and I felt like, okay, that's really cool. It's a female, and she's kind of done this before. She had a lot of respect for Dr. Palmer and the endo side of things, and she knew where her lane was, and she knew that was his lane. So I felt very taken care of by them.
Good.
And that's when she started me. She wanted to do letrozole, and that is not primarily a drug for fertility. It was originally diagnosed or used in
That's a good question. What is it? Letrozole is what we call an aromatase inhibitor. Oh, God, this is just
you
so
love that word.
Well, it's just so interesting because when we're coming back to endometriosis, I should say, is that this explains why postmenopausal women can have active endometriosis, because the endometriosis can create its own fuel. It can create its own estrogen, even if you take it away with what's called an aromatase. So that's an enzyme in our body that converts one thing to another.
Okay, so I looked it up. Dr. Google again.
Is that you snoring?
No, I like the word aromatase.
I know, isn't it great?
It sounds like it smells and it tastes good.
It sounds like a spritzer you'd put on top of a boat drink.
But it's not.
It's not.
And letrozole, brand name Fermera, was originally it's a hormone-based chemotherapy. Google says, and it was used to treat breast cancer. So you do kind of have to sign a waiver saying that you're using this drug for something it wasn't originally intended for. But they find that it works better than Clomid to help trigger ovulation for women who may have PCOS.
Yeah.
So that's the drug we used. And what I would say about going on any drugs, whether it be letrozole or Clomid, the best thing that the clinic did for me is they incorporated monitoring.
Yeah.
And from a financial perspective, you're out of the insurance zone unless you have fertility coverage at this point.
So they did ultrasounds before your cycle and then at mid-cycle so they could determine exactly when you were releasing an egg.
Yeah.
So you're not just guessing.
Exactly. And
which is how it should be done.
I agree. But not everyone will do that. They'll give you the drugs and then they kind of still send you off on your own with your like home test. But I would say...
Which is not a good idea.
I agree. And I would say, too, you're not getting your money's worth from my perspective. And what I liked about this, because you can do these medicated cycles this way with your IVF clinic, your reproductive endocrinologist, or my OBGYN clinic offered this. So they had like a cash payment plan. It included, I don't remember exactly the price, like $500 maybe, let's just say. It included all of my ultrasounds for that cycle and my doctor's appointments. It did not include any of the medication or when we got to it, an IUI, which is intrauterine insemination. So we did a medicated cycle just with timed intercourse, and that's when I had a lot of dates with Wanda. Did you get that?
I got it.
Wanda.
Do you want to explain? I wish we could take a picture of you using your hand there.
Dun, dun, dun. I know. It looks like I have a lightsaber or a sword.
Yeah.
Wanda is what I didn't come up with this. One of my favorite podcasts, The Infertile Mafia, came up with this, I think. And that's a date with the ultrasound, but it's not like one of those cute ultrasounds on the movies where someone's pregnant. It's over their tummy with like the warm gel. No, let's just put it this way. It's usually cold gel. And Wanda goes inside of your vagina and loops around in there and gets some nice images. And at first it's probably really awkward, but then by the time you're at this point, you're having several dates with Wanda in a cycle, like sometimes 4 or 5. Yeah. And it can be kind of cool because you're seeing your ovaries and you watch the follicles develop.
Yep.
So when I'm doing these medicated cycles, we're watching the follicles develop and they're like, oh, you've got a really great one on your right side. Like it's this many centimeters. And then they tell you the next step is you're going to trigger.
Yep.
And the trigger is, in my case, I did an HCG trigger. And that's the...
Ovidrel.
Yep. Yeah. Yep. And it's expensive.
Yep.
And it's a shot. And that triggers ovulation. So it triggers the release of the egg. And depending on the dosage they give you, they tell you when to have timed intercourse again then. And that's supposed to be like your shot.
Yep.
So we did that. And then we moved on to the IUI the next time. So.
And how many times did you do that?
We did 2 IUIs, so that's the intrauterine insemination. So,
which is where we take your partner's sperm and it gets cleaned and washed. And
I always love that term, washed.
Yeah, it's like going to.
They run it through the rinse cycle.
That's right. They spin it around, and they're all clean and ready to rock.
And they put it in this like fluid that is supposed to assist.
Yes, it's it preserves them. It keeps them healthy. Because there's a little bit of time between when you do the semen, the sperm prep, and the time it's actually put inside the uterus.
Right. So we did that, and then I went into the clinic, and they like turned the lights down for me, and I like got my radio voice on now, and they made it very comfortable.
Turn the lights down low.
No, there was no music.
Hold me in your arms.
When you do IUIs, do you sing to your patients?
I may have done that with particular people. You got to know your audience, right?
Yeah. Okay, so my doctor did not sing to me.
No.
But then they put a catheter through your cervix, which that part is a little painful, I will admit.
Yes.
And then they insert the sperm, and this is after you've triggered and they know you're like ready to ovulate. Yeah. They get the sperm up there right before the ovulation will happen.
Right.
And then they have you lay there for like 10 to 30 minutes. Yeah. And
meditate on fertile thoughts.
Yeah, I have a meditation app I can share with the team that I use that I really liked. And you just do a lot of hoping, and then in 2 weeks you pee on a stick and you pray that it's going to be positive.
Yep.
Well, it wasn't. So, and I don't know. I think everyone asks all the time. I'm in a lot of fertility groups on Facebook and stuff, and everyone asks like, are IUIs worth it? And I would say the next step for most people is IVF. So unless you're ready to make that financial jump, because IUIs, I would say on average are between $1,000 to $1,500, depending on where you're going for one cycle.
Including ultrasounds and
Correct.
and medications.
Actually, no. The medication might be another $100 to $200, depending, and if you have any insurance coverage. But when you go into the IVF and the more assisted reproductive technology side of things, it gets exponentially more expensive. So if you're still wanting to try something, I would say IUIs are great, especially because you get in this mental headspace of infertility where you feel like if you're not doing anything, then you're no longer trying.
Right.
And you continue to miss your window.
Right.
So for me, it was almost more self-care.
Yeah, therapeutic. It's
because we knew we weren't ready. We didn't have the finances yet to do IVF.
Right.
So it was something we could do. And I will say that, another piece of the puzzle here is that it isn't always just one person. So you might have endometriosis and you might have this inflammation and this pain and then maybe you've had surgery, but you're only half the equation still.
Right.
So it was really important for me, and my husband was great about this, but it's not comfortable. They don't like it, but he did have several sperm analysis done.
Yeah.
And I mean, if any guys are listening here, just do it.
Yeah. Can I just say something that maybe is that I feel like your partner, compared to everything that she is doing to get pregnant, doing a semen analysis is really not much.
Do you need me to describe Wanda again?
Yeah, well, I'm just saying that all the different procedures, the labs, test to make sure that your tubes are open, and all the man has to do is go in and just kind of do what probably he's done before once,
right?
Maybe
at least,
probably just once.
And I'm not going to say that it's easy because.
And it's not painful.
No, it's definitely. Well, hopefully
it can
not.
be embarrassing.
If it's painful, then I think you need to talk to your doctor about that. But I would say I respect that it's not easy, and I know that performing under pressure.
I agree. I'm not trying to say
hard.
Yes, I will completely agree. It's not comfortable. It's embarrassing, but I just think, come on,
do it.
Be a good partner.
Yeah.
Just step up to the plate and knock it out of the park, or at least to first base. I just get a little bit of, just, what I'm trying to say. Just get something in the cup.
No, John did say I could share this.
He's a good man.
He was at the end. You have to figure out a way to cope with all of this.
Right.
So one of his coping mechanisms was obviously to make light of it, as was mine, talking about my dates with Wanda. And he'd be like, "Hey, babe, only took 2 minutes today." And I'm like, "Nice." And he's like, "I know."
Nice.
So he'd make it fun, and we try to be lighthearted about it because this whole process is, one, not romantic.
It's sad
and really
it's
stressful
for most people.
Yeah. So try to have fun with it. But I would just say, if you want to rewind and play this part for your partner again, because maybe they're dragging their feet, describe Wanda and then tell them just to do it.
Yeah.
Go for it.
And also I would just say for the partners that are trying to do the semen analysis or semen collection is that it is normal to be horrified and embarrassed. And some people can't do it.
Yeah.
They really, and some people there's a lot of reasons why people just have difficulty collecting under those circumstances. And there's ways to work around that if we have to. And so it's hard to say don't be embarrassed by it because people are, but just to kind of allow yourself the permission to be embarrassed. And
so everyone's embarrassed.
Right.
So you're not alone in that by any means. And I think some places will let your partner assist you if you want.
Yeah.
Other places will let you do the collection at home.
Yeah.
So, feel it out with your clinic, but it is an important step. Yeah.
Brett.
Feel it out with your clinic. It's hard not to go there with this one.
Brett. Family show.
All right. So the next step for us, because that wasn't working and we were pretty heartbroken, was to go on to see a reproductive endocrinologist. So we went over to CRM, the Center for Reproductive Medicine here in Minneapolis, but I know that they have a network of clinics, and met with Dr. Casey. And Like
Dr.
any good
Colleen
thing.
Casey, a
Yeah.
kind soul and a wonderful human being.
She's fabulous, man. And I would tell you again, this is where I did not just like sign up with the first person I found. I read a lot online and I reached out to a lot of people locally. That's one thing I will tell you is I know that infertility and endometriosis and all these gynecological issues can be really hard and very isolating.
Yeah.
And I have to say, you know, the minute I stopped saying to people when they'd ask, oh, when are you having kids? Or are you guys trying? When I'd stop saying, maybe one day it'll happen or not right now. And, you know, saying that stuff was a lie, number one, and it broke my heart.
Yeah.
But the minute I started saying, oh, we are trying, you know, sometimes I get some unsolicited advice like, oh, are you tracking your cycle? And I'm like, I have been for a year and a half. You know, shut up.
Yeah.
But sometimes I would get people who are like, oh, I went through that. Or, yeah, I also have endo and this was my issue.
Yeah.
And again, the more I got used to sharing my story, the more people came out of the woodwork to share theirs, whether just to empathize or in some cases to recommend people. And that's how I found CRM and Dr. Casey.
Yep.
And two of my friends had been there and worked with her and had successful pregnancies and now have children. So I was like, okay, well, that worked for them. Yep. And what I liked about her was she was all science. She was very compassionate, but I went in, she drew a diagram for me and my husband, and she talked us through the whole process. And, you know, one thing I wasn't expecting is if you're ready to pay, they're ready to help you. Like, you can move as fast as you want when you're at that phase. And I was just so used to, you know, the surgery side and then the waiting and the recovery and trying for several months. And now let's do medication. But we were to the point where, you know, we're coming up on the end of year 2 here. And it was like, how fast do you want to go?
Right.
And she said, well, do you want to try another IUI? And that's when she recommended we do an SPA, which is a sperm penetration analysis test. And John's like, well, all my tests had come back great. And that was very true. All of his sperm analysis tests came back great. But this is a special test that they do just at the end before IVF to say, are you going to do ICSI, ICSI, or
cytoplasmic sperm? No, I got it.
There's another I in there. Injection?
Intracytoplasmic ICSI sperm injection, I think.
Yeah. Well, basically, I don't need to know what the acronym means, but it's when you're doing the IVF process, when they get the eggs out of the woman, what are they going to do with those eggs? Are they going to just set them in the Petri dish and let the sperm intermix in there and see what happens naturally? Or are they going to pick the best sperm and inject them one at a time into each egg?
Right.
And so this test helps you determine that. And we decided, based on that SPA, you know, it wasn't that much more expensive, and your odds go up significantly for the number of embryos and how many and, you know, actual potential future babies you get. Yep. So we decided to go down the ICSI route and skip doing another IUI. And that was the point where it was like November. We're like, do we want to spend another $1,200, $1,500? And I didn't necessarily like the IUI process. Not that anyone does. People call it the turkey baster method, I forgot to say.
Yeah.
But so we decided to just have like a nice Christmas, a nice holiday season, Thanksgiving, and focus on just enjoying each other. And of course, I was really hoping I was going to be one of those people, right? Where, you know, you've maybe got IVF scheduled and it's on the docket. And then, like spontaneous.
Yeah, it's amazing. It's an odds game. It's an
but
odds game.
You never know.
You never know.
I hope that's you. If you're listening and you're in this position, I really hope that's you, because that would have been pretty badass.
Yep.
But we didn't get to that point. And so when the next year came around, we had saved all of our pennies together and we were ready to do IVF. And I was really glad that the clinic was ready to move with us when we were ready to move. Yeah. And I chose to do the Attain program. So that's kind of a guarantee
It's like a warranty program.
Yeah.
Yeah, like you get pregnant or you get some of your money back. Is that right?
Yeah. Well, the way you have to do an AMH test. So that's the anti-Mullerian
hormone.
And what is that?
That is a hormone that we can test that gives you an idea of what we call ovarian reserve, meaning how many eggs there are left over.
Right.
And it's and so but it doesn't tell you quality. And so there's quantity and quality. And AMH and FSH and estradiol and those things tend to reflect more.
Those are all like hormone
yeah,
levels.
that you can test to look at ovarian reserve, and they tend to give you a sense of how many eggs there are left to ovulate, roughly. But a normal AMH is correlated with successful in vitro fertilization.
Yeah.
So they want, if they're going to, if you're going to go into something like you can call it a warranty program or a risk sharing program, you're both kind of assuming some risk in the deal, and so they want to make sure that that there's a reasonable chance of success.
Sure. So we did that, and I had a normal AMH level, and I was 30. How old am I? I was 32 at the time of all of that, and
so you're young.
I mean, so that's what's interesting too. I felt old, but in working with the reproductive endocrinologist, she's like, "No, you're not.
Yeah,
you're not old. Like you're young, and still you should have a lot of eggs left." Right. But I have friends who are younger than I am whose AMHs came back lower than that. I don't even remember what my exact number was. I'd share otherwise, but that's kind of how we decided to go down that route. Right. But all in all, I think, the whole infertility road itself is really stressful, and it's hard not to be stressed. And I hate when people say,
just relax. And you wouldn't be a human. It would be almost like a psychological diagnosis if you weren't stressed out about it. It's just not normal.
And it affects both people too.
You probably know this, Britt, but they've done some studies on levels of loss or grief, and going through infertility is as painful a process as a death of a loved one or divorce. It's right up there with just immensely painful and stress on couples. So couples go through a lot of.
Well, I was saying to my mom in the car, because she hadn't had this experience, and she was trying to empathize with me, and I said, "Mom, it literally feels like a part of me dies every single month, and I go through this mourning process."
Exactly.
And then I gotta kick myself back into gear again because otherwise I'm gonna miss the next month. And so it's this roller coaster. And if you're not willing to ride it, you're not really trying anymore. At least that's what my brain was telling me. And it's so tricky. So if you're in the midst of it, seek obviously medical help from, your OBGYN or hopefully you're a fertility specialist if you have the means. And then I'd also say be kind and be gentle on yourself. Yeah,
and you mentioned the word roller coaster, Britt. You can stop and get off for a while and get back on.
Yeah.
And so I think sometimes people feel like they got to start and then they just got to keep going.
That's how I felt.
And I've had people stop for 3 months, for a year, for 6 months. I'm not suggesting you do that, but you can, take a break. I want to just add on to what you're talking about, which is that in the fertility process or the infertility journey, especially if you've got endometriosis, you want to kind of be realistic and appropriately aggressive.
Yeah.
So, like in your situation, you are young, and you were young when you were going through this phase. So there's a little wiggle room. Like you can try this. You can try some inseminations. You can try letrozole, Clomid, and that sort of thing. And, try it for a year and a half. And if I'm not saying that's, not everybody would choose that, but you're probably not losing a lot by spending some time.
Right.
Whereas if you're 38 years old, just statistically, you have an age-related decline in your ovarian function that waiting a year and a half to figure out how to get pregnant on the best way could be the difference between being successful and not.
Right.
And so your doctor should be communicating that with you and helping you decide how aggressive you want to be. Because, again, I'm just looking from my standpoint. I know that Dr. Palmer's group would do the same thing. If you were 38 years old, they probably wouldn't have suggested putting you on letrozole and doing insemination. They would have just sent you to IVF or recommended that.
Right.
People do what feels right for them, but you want to you want to keep in mind the other factors that can affect success.
I agree. And if we're doing our due diligence here, they do say if you're under 35, they like you to wait a year before you seek fertility support.
If there's nothing else going on.
If there's nothing else going on. Well, I found out I was stage 3 with my endo, but I still waited that long. But that would be a reason to maybe seek assistance faster.
Yeah, it depending on this, and everybody and every couple is different. And some people, I've had people say, well, we want to go this far, but we're not going to go any farther. We're happy. Every family's different. Every partnership is, and they may be happy with not having kids.
Right.
And there are people and couples that feel like this is the primary goal of what they're trying to get to. And you need to kind of work with people to decide, again, how aggressive you need to be given, what the unique situation of your patients.
No, I agree. Well,
you do?
If you have endo and you're facing fertility challenges or you're afraid you might in the future, I get a lot of really young people in our support groups asking, hey, my husband and I just got married. We're in our mid-20s. Should we be worried about this now? No, I'm not telling you that you need to be worried. Yeah. But if you're curious and you want to know more, I love that book that I recommended. And then if you're on the fertility roller coaster and you're looking for some lighthearted fun, I really like the Infertile Mafia podcast. I think there's two women and they're based out of Chicago. Both of them have different stories and they've gone down the IVF route, but they have some great content on there and they're also really funny.
Good. That helps, doesn't it? When you're grieving and you're in pain, it helps to laugh a little bit.
There's a Instagram, Hilariously Infertile, and she's great too. Because you just need some lighthearted, and people who understand, fellow infertiles understand your struggle. Yeah. And I think if you're looking for some resources and where to go next on the infertility side of things, I really like those couple resources. One
other thing I want to add is that you mentioned that you're stage 3, right?
Yeah.
So for most people who have endometriosis and have had surgery may know about the staging system. There's stage 1, 2, 3, 4, minimal, mild, moderate, and severe. And when you're trying to figure out, again, the appropriate level of aggressiveness in terms of helping, that's something to kind of keep in mind because the staging system was actually designed by the American Society of Reproductive Medicine. It does not reflect pain. So that's why, and people know this, you can have a stage 4, horrible, horrible, severe endometriosis and have very little pain.
Right.
And you can have stage 1 or 2, mild, minimal, and mild, and have horrible pain. So when you're trying to, the chance of getting pregnant with spontaneously on your own with a stage 1 and stage 2 is much better than a stage 3 or stage 4. Mm-hmm. So again, when you're young, and if you're in your early 30s or 20s, a lot of people want to try less aggressive things for a while.
Right.
But if you're 38 and you've got a stage 3, you're probably, because the spontaneous pregnancy rate with a stage 3 is less than 5%.
Okay.
A month. Normal fertility, or what we call fecundity, as they say in the South, fecundity, is about 25%, 20 to 25%. And so you're going from that, which would be normal, to less than 5%. Again, it's an odds game. People get pregnant, but you got to keep in mind the unique circumstances that, if you're older and this is a major priority in your life, you want to be aggressive.
Yeah, no, I agree. Well, thank you so much for chatting about this with me. We'll make sure to have, you're welcome. We'll make sure to have resources and some links of some things that I use that really helped me on my journey. And as always, if you have any questions on this stuff, we love to chat about it. So let us know.
Are we going to talk some more in the future about fecundity?
No, I don't know what that means.
It's the ability per cycle to get pregnant.
Oh,
that's a great word.
Thanks so much for chatting with me today about infertility. I can't wait to chat again, Dr. Hegart.
Me as well.
See you soon.
I as well. See you soon. Thanks for listening.
Thanks so much for listening. Be sure to connect with us on Facebook at facebook.com/The Endocast. Our theme song is Renegade Energy by Tacky Annie. This is a Matriarch digital media production. Learn more about Matriarch and check out all their great podcasts at matriarchdm.com.